Hello humans. Today's episode we're going to go over how to treat a acute knee sprain. A few days ago I aggravated my right knee being on the monkey bars and the next day the knee blew up on me. So I wanted to devote today and show you guys how to treat a acute knee sprain. Let's go over some education and we'll get right into it. So from like an anatomy standpoint, your knee joint is basically made up of four bones. You have your femur, you have your tibia, you have your fibula, and then you have your floating bone, which is your patella. These four bones make up your knee joint. Your knee joint flexes and extends. That's all it's made to do. Most likely what I've done is aggravated the deep ligamentous structures, probably ACL or meniscus. Most likely my meniscus, due to the fact that I could bend the knee and extend without popping, which can also be a biomarker flag for a meniscus tear. But without diagnosis, we're not going to worry about that. What we're going to worry about is getting the knee feeling better, getting it more range of motion, and also showing you how to treat a swollen knee back to just pain free. Okay, so once you understand anatomy, which is just basically four bones that make flexion extension, what do? The first step is we have to get the swelling out of the joint line. The swelling inactivates the muscles, so every time you take a step, instead of your muscles working, it's just your joint being pounded on over and over again, which basically is just going to swell up even further. So with the swelling, there are a type of technique called instrument assisted soft tissue where we use steel tools. Sometimes they're also called Graston instrument assisted soft tissue or gua sha. Basically, it's been designed on an angle so you could save your fingertips from rubbing out the swelling out of the joint line. Pretty much what it is. We used our metals, created a tool so we don't have to use our hands and rub out the swelling. So with the joint line that I have here, a lot of my swelling is above the patella and behind my knee. So with restriction, I only can bend my knee right about there before I feel a lot of full sensation in my knee. So with the tool, what I'm going to do is we're going to re-spark the healing process. We're going to use a little bit of cocoa butter and what am I using? Coconut oil and cocoa butter. We're going to lubricate the joint line and all the tissue surrounding it. And then we're going to attack it with the instrument. So with using an instrument, there are little tricks with attacking the knee. To rub out the quad, one needs to bend the knee as much as they can. So if you have a lot of restriction, you can't bend it, just do as your best and eventually try to get it as far as you can towards your heel. And find an angle and then start using a tool. And if you don't have a tool, you can use a butter knife. And basically start at the lateral point, try to go over tissues, not bony landmarks, and go up and down, get the swelling back into the heart and out of the body. So I'm going to spend some time and rub the swelling out of my joint line and back into my quad where it could get pumped out of the body. With the quad, you do have to make. Most people don't know when your leg is completely straight, your quad is at its shortest. So every time you bend it, the quad lengthens. It actually doesn't shorten. So let's start making those angles less sensitive by bending the knee and rubbing those tissues and swelling out. Spend a few minutes. The more you frequently do this, and in my case, I do this frequently, from a professional standpoint, so I am a sensei at it. The more you spend time with these tools, the more of a pro you become. Just like with any skill of practice, time spent, become a pro. But in this case, I'm just rub from joint line down. Make sure you're covering most lateral region near the IT band. Insertion. And going into more of the intermedialis, lateralis regions. And then attacking the VMO, vastus medialis, oblique region. And also the adductors here. In my case, the adductors are a little sensitive. That could tell me that they are also inflamed from the playing on the monkey bars and aggravation. So this is generally an acute sprain. I don't think it's level 2. I don't think I tore anything. Only imaging can reveal that. These are just tests that I've done on myself. So now I'm going to rub the inside of the groin, the vastus medialis muscle groups. I'm just going from the joint line all the way back to my quad as far as I can. So once you do your quad and your groin and your lateral IT band region, to get to your calf and your hamstring, your leg has to be straight. Unfortunately, if you had somebody else doing it for you, you'll be on your tummy. But for the case of this video, I'm going to just basically use the tool and go underneath my calf, upper calf, your calf inserts into your meniscus, or its origin, it's in the meniscus. So in my case, I have more restriction in my hamstring groups and my calf, which limits my knee flexion, than actually my quad. So I'm going to rub my calf, the lateral and medial muscle group. And then I'm going to start going into my hamstring tendon, my membrosus and semitendinosus. And I'm also hitting my rectus femoris muscle group. And I'm just going to go in between as well. Spend some time rubbing it out. And this is your first step anytime you're recovering from a knee injury. You want to make sure the swelling is outside, getting out of the joint line. If the swelling is there, it's hard to get the muscles firing and engaging, which then is a problem onto the bones and tendons and ligaments. If the muscles aren't firing or engaging, you have a problem that becomes a joint line issue. So this is just a really clever way of re-sparking the healing process. So as I'm rubbing, body's recognizing a alert system with a threat. So it's sending the blood flow to this region. And I can really feel warmth increase of temperature in the joint line here, which is basically your natural medicine. Majority of your body weight, or majority when you're at rest, 80% of your blood is running through your organs and 20% through your arms and legs. So as I'm doing this, the body recognizes this as a threat, flips the proportion. So you have 80% going through my extremities and 20% through my organs. So that's why everybody needs to exercise. It's not for vanity reasons, but also for health reasons. The blood changes proportions, 80-20 at rest to 20-80 on active. So once I feel that's relatively done its job, and I don't, more is not necessarily better, you'll find spending about 10 minutes in the front part, 10 minutes in the anterior and posterior region of the muscles, and a little bit of lateral. That's all you really need. So that's the first step. Once you are able to rub out the majority of swelling, and you won't get all this out in one setting. You're not going to get all the swelling out in one tool instrument massage. I'm going to repeat this tomorrow, and then so on and so on until completely this feels normal as this one. So I'll use this as a baseline and make sure this is so up to par with its left knee. So once you're done rubbing, you're going to use a towel and you're going to place it underneath your knee. And now we're going to make sure those muscles that make the knee straight, that they're working. So basically, don't lift your heel, squeeze the quad, pushing the knee into the towel. You'll feel these muscles engage. Your job is to hold it for 1, 2, 3, 4, 5, and then relax. We're sparking the fire for the camping. So with analogy, it's hard to start the fire with sticks and rocks, but once you get the fire going, it's relatively easy to get going. So this is not more, so it goes back to what I'm about to say. More aggressive is not better. It's about engaging the muscle, technique oriented, making sure the right muscles are working, minimal pain in the joint line. You might have a little bit because you just had an injury. 2, 3, 4, 5, and then you're gonna relax. You're gonna go for about 15 repetitions, a few seconds rest in between. 1, 2, 3, 4, 5, and relax. This is important. This is what your knee does every time your foot hits the ground. Your knee bends and extends. It stabilizes in between the bends and extends. This is its first function. Can I get the leg completely straight? Can I have these muscles on top engage and have minimal joint line pain? And relax. 1, 2, 3, 4, 5, and relax. These are called quad sets in exercise in the rehabbing world. 1, 2, 3, 4, 5, and relax. Quad set 1, 2, 3, 4, 5, and relax. Very simple. Squeeze that quad 1, 2, 3, 4, 5, and relax. It's not how fast you do these. It's about quality feel, minimal joint line pain, engaging that for 5 seconds, consistently through the 5 seconds, not losing activation, and relax. 15 repetitions. This is the first exercise you want to perform after the instrument-assisted tissue massage, or gua sha, as they say in the Asian community. Squeeze, squeeze, squeeze. Good contractions. Pain-free, or minimal pain, as you'd say. It's okay to have a little bit of discomfort due to the swelling, and you just coming from a acute injury that you, whatever the mechanism, whether you fell off a bike, twisted the wrong way. 3, 4, 5. Goal is to progress eventually to you have minimal pain with these quad sets. This is like doing a math analogy. 1 + 1. This should be the easiest things you could do. If you can't do this quad set, you can't perform a squat. You can't walk long durations. You can't lunge, jump, and so forth. So this is the foundation to like a math analogy. You can't go into calculus if you don't know addition. So squeeze. 1, 2, 3, 4, 5, and relax. So that's step 1. Step 2, I'm going to put the camera out a little further for everybody. We're going to bring in a foam roller. You can use something else if you don't have a foam roller. The goal here is to get a little few degrees So now that was 0 degrees. So this activity with the foam roller is now, can I get the knee extending through going through a few degrees of range with a hold? 1, 2, 3. And then come back down. Very simple.
You lift the leg, you hold it, 1, 2, 3, and you lower. Make sure it shuts off. Use your other foot, raise it, feel the muscle engage, hold, and then you lower, relax. Use your other foot, raise the heel, hold, 1, 2, 3, and let that knee or let the heel fall to 20 degrees. So this is a little bit of a quad eccentrics. We're using the other leg to stabilize. That's going to engage the muscle. And then bending the knee or dropping the heel progresses the bending and extending, which the knee does. Very simple. We're going to use the other foot, raise it, hold, 4, 3, 2, 1, back down. Lift the foot into the air, hold, 1, 2, 3, control down, and relax. Use the foot to lift yourself up, hold, 1, 2, 3, good, control down. Use the other foot to lift the foot, hold, 1, 2, 3, back down. 10, 15 repetition usually does the trick. Hold, 1, 2, 3, nice and down. Once you're done with the first one, we're going to use a foam roller for one more quick exercise. Well, now you raise it up. 1, 2, 3, with no assistance. So now can I move the foot or the knee through a few degrees, hold it for 3 seconds, and bring it back to rest. Extend the knee, hold, 1, 2, 3, lower, relax. Squeeze the quad, raise the foot up in the air, 1, 2, 3, lower the foot, relax. Make sure this is shutting off and shutting on like a light switch. So when I raise the foot into the air, I'll feel these muscles engage, minimal to zero joint line pain. 2, 1, lower, relax. Very simple. You could use your other foot to measure whether you're, level toe to toe. Using your other leg as your baseline is a helpful aid. Very simple. Raise the foot, hold it, make sure these muscles feel it. 1, 2, 3, lower, and relax. Very simple.
Third exercise is a complementary exercise. We want to make sure this bone doesn't lose rotation, so it's more complementary exercises to support the knee. Every time your foot hits the ground, most people don't know that every time the foot hits the ground, butt supports the leg or the forces. If the knee's not working and this muscle here isn't engaging, it's going to collapse the knee valgus in. So next exercise is actually preventative at the butt region to make sure the knee has muscles up top supporting the flex and extending it does. So the next exercise requires you to be on your side. You're going to bring your knees up to about 60 degrees. You're going to push the feet forward. So you want to be mindful of form. 3 things. Your feet should be underneath your knees should be in front of your chest. And the last part, you want to make sure you're not too hiked up at your hip level here. Once you're pretty passive, you're going to go through three-part series that forces this bone rotate and abduct, which will get the butt firing. First one is knee, ankle, ankle, knee. Knee, ankle, ankle, knee. Knee, ankle, ankle, knee. 4, 5, 6,
7, 8, this is 9, and this is 10. Felt my butt working, try to get as much mobility of the femur as I can. Second exercise is same position, but the angle changes. The feet are high off the ground, stacked. Don't worry about how high, just level. And then we're raising and opening for 10 repetitions. 3, 4, 5, 6, 7, 8, 9, 10. Feet down. Once again, I just felt my butt work, a little joint height sensitivity. Sometimes if you're having a lot of knee pain as you're doing this, your knees might be too high. So it's really about just making sure your knees are about 60 degrees flexion. So when we walk, our knees are about right about here when we extend our foot forward. So this just helps prepare muscles and bones for activities and movements of everyday life. Third exercise with this, you'll make sure the top femur is as long as the bottom one. You're going to raise the ankle and knee and back down. All butt. Moving the femur, making sure the butt works, which is a complementary muscle groups for the knee. Back down. Back down. Just forward. Make sure you're not hiking, you're just doing a leg raise. So make sure you're not feeling your crunch muscles, you're feeling your pelvic butt muscles. Forward. 5, 6, 7, 8, 9, and that's 10. Next exercise. We're going to use the sideline position for the next exercise, but you're going to need a towel and your ability to lay flat against the wall. So once you're completely against the wall, you place the towel behind your heel. So now I'm going to teach my leg. Can I raise my leg while keeping my knee straight and making sure my butt does the work? So knee straight, top leg as long as the bottom leg. So we're not hiking up here. Don't arch the back, don't flex the back. Nice and level, midline stabilization. Leg raise, 1, 2, 3. Let gravity do its job. So it's basically a leg raise, don't let the towel fall, don't arch. Back down, 2. Belly button in, leg raise, 1, 2, 3. Back down, belly button in, leg raise, back down, 4. 1, 2, 3. 5. 1, 2, 3. 6. 1, 2, 3. 7. 1, 2, 3. 8. 1, 2, 3. 9. 1, 2, 3. 10. Once you do 10, of course, I'm a big fan of leveling things out. So as you do everything on your right side, do everything on your left side. For the video's purpose, I'm going to perform everything on the right side so it's not a long video. So once we are finished with the hip, what we're going to need to do is start teaching those muscles land-based forces. Can't just do everything in the sideline. So now we start transferring all those muscles that you prepare and they're firing correctly into standing activities.
Next exercise requires a band. It's going to go around your knees, right behind your problem or your injured knee. And we are going to stand in a staggered stance. That's actually so the idea here is to use the tension to bend the knee. And as I use the heel down, that's going to force my knee to straighten out. The applied tension of the band is going to force the quad to engage. Your job is to hold it for 5, 4, 3, 2, 1. Let the band bend the knee. You're just going on your toe. A great exercise, teaching those stabilizing muscles, forces of ambulating. 15, 20 repetitions, staggered stance, pulley system band. More tension is not better. It's about getting the knee straight, pushing the heel down, holding it. 1, 2, 3, 4, 5. Onto your toe. Push the heel down, feel it engage. 1, 2, 3, 4, 5. Onto your toe. Push the heel down, feel the muscle engage. 1, 2, 3, 4, 5. Onto your toe. Push the heel down, feel the muscle engage. Minimal to 0 joint sensitivity. We'll take 2 out of 10 pain, 3 out of 10 pain. But as you perform these exercises more disciplined and more repetitively, your pain should start subsiding and also the swelling should start disappearing. Squeeze the quad. Feel good muscular contractions. They're not causing joint pain. Quality over quantity. Start teaching the joint line pain-free repetitions. Squeeze, 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 squeeze. Hold. 1, 2, 3, 4, 5. Bend the quad. Push that heel down. Feel it. 1, 2, 3, 4, 5. Push that heel down. Feel that engagement. 1, 2, 3, 4, 5. Beautiful. So those are terminal knee extensions. They really help understand moving and ambulating. It's a great exercise to transfer over toward recovering from an injury. So doing that does transfer over very nicely toward life. Next exercise, the balance exercise. I'm using a pad, a very soft pad. If you don't have a pad, you can use a couch cushion, stack up some towels, or just use level ground, okay? And your goal is to go 30 seconds. Try to keep your quads relatively pain-free by engaging the quad and try to do a 30-second hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Step off.
I'm a big fan of just alternating, giving each leg a chance to break. So just do the opposing side for in between. So that leg that you're rehabbing has a chance to recover. Also, you're just sharing preventative skills to the healthy side. 2, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One set. The pad teaches the quad to react to reaction forces. The world's never still. You're never still. Your heart's pounding. You're breathing. The world's spinning. So the motions or the foundations of life is never still. One of the hermetic principles is everything vibrates. So you're always moving slightly. So when you're doing this exercise, figure out where you're displaying majority of your weight. So if there's 3 points of contact, some of your toe, some of your midfoot, some in your heel. So break that weight distribution out evenly. So if you feel you're too much onto your toes, try to shift a little bit more midfoot and heel. If you're too much heel, try to shift a little bit forward. It's like a rocking boat. You want to have even displacement. You're always going to be kind of reacting, but you're teaching the knee to be stable. You're teaching the quad, the calf, and the feet to work one another. If you're having a hard time with balance, use a stick or a foam roller to create confidence and pain-free stability holds. But ultimately, you should have the ability to not have anything and stand on one leg, especially on unlevel surface. Also, make sure you're not dropping your hip. There's a tendency when we stand on one leg, we just drop the side that's not on the ground. So level hips, knee straight. You can see me kind of reacting. It's not increasing my knee pain, but I do feel some sensitivity. And that's about 30 seconds again. So that's the most dynamic part of the exercises when you just recently had a knee injury, like myself, or acute knee sprain. Once you are done with the instrument-assisted soft tissue work, engaging the muscles, taking them through specific therapeutic exercises, the last part to making sure your session of treating your knee is basically passive stretching followed by 10 to 15 minutes of icing. So with the passive stretching, there are pretty much 2 simple stretches or active. One of them is just getting your heel bending, extending as far as you can. So basically slide your heel as far as you can. In my case, right here, I feel restriction. And I'm just going to slide that heel completely straight again. Just flexing it as far as I can. And then extending it as far as I can. Ideally getting that quad set to engage. Flexing it. And then extending it. And we're just trying to regain the joint range of motion. It's hard to do this beforehand because of all the swelling you might have in the knee. The soft tissue massage with the instrument, followed by the exercises, helps getting that swelling out, which helps you regain range of motion in the joint. So about 20 repetitions to 30. And then you follow it up with a cold pack, submergence and cryotherapy plunge, or a cold shower is as effective. 10 minutes is no more than 15 or 20. They've done studies where somebody who took a
ice bath in 10 minutes, or a joint line wrapped in 10 minutes, joint line for somebody who's wrapped in 15 minutes, and joint line wrapped in 20 minutes. More than 10 minutes is not more effective than somebody's doing 20 minutes. So after about 10 minutes of icing, your body actually starts recognizing the cold as a threat, and it starts protecting the body. So 10 minutes is all you really need for icing the joint after you do all this. I highly recommend the routine. It's the safest thing you could do for an acute injury. This is day 3 for my rehabbing the acute sprain, and I will keep you guys updated on a daily video log regarding how my progression is. I'll probably have a follow-up with progressive exercises in a few days regarding the topic. But please like and subscribe the video, share with others, and please use this as an educational video for yourself if you ever did have a knee sprain. Like I mentioned, I have an acute level 1 meniscus sprain. It's probably from my years of basketball. I played basketball pretty much 20 years, so I probably have some tears. Played on the monkey bars, aggravated knee blew up. So I decided to make a video for you guys and show you how you don't need anything, just a few exercises to get the knee better. Please like and subscribe, like I mentioned again, and